guys, this is Dr. Hub. Today we are going to look at the drugs which are used, and this is in case of the organophosphorous poisoning. So to begin with, there are some symptoms and we are seeing the treatment for that respective symptoms. So in case of the muscarinic symptoms or the CNS, so muscarinic or the CNS, so in this case we administer the atropine. Next is in case of the nicotinic. So in terms of nicotinic symptoms, there is the ralidoxin, which is used for treatment. First is in muscarinic, it is atropine, and nicotinic, it is ralidoxin. Then in terms of the nicotinic, so in terms of the nicotinic, greater than the muscarinic acid. So nicotinic greater than the muscarinic acid and the CNS effects. Muscarinic acid and the CNS effects. So what is the drug in this case? In this case, the drug is nothing but there is a diacetyl monoamide. There's a diacetyl monoxide, and this is a specific cholinesterase reactivator. Next, we move on to the symptom of convulsions. So we look at the convulsions. So in terms of convulsions, what do you see? There is IV diazepam. Then comes the pulmonary edema. There is pulmonary edema as well as the bronchospasm. So what is the bronchospasm and the pulmonary edema treated with? So there can be the oxygen, then the atropine or the intubation. Next, the positive pressure ventilation. So this was all about the drugs used in organophosphate poisoning, the symptoms and their respective treatment. To learn and grow daily like this, please do subscribe.